Before Amy Heymans became a regular in our predictions series, she joined me in November 2021 to share how design thinking catalyzes consumer-first healthcare. She discussed how to use design thinking principles to break down silos and bridge the gulf between designers and builders. The industry still needs help to harness the rich value of co-creation and deep empathy that she described. So let us know what you think about this latest in our greatest hits collection.
The flow, the flow, the flow.
All right, it's time for some more provocative thinking. And to help us out, we've got Amy Heymans in the house. I'm so excited for this. Amy's founder and chief experience officer at MadPow. A lot of you know her and the work she's done and the amazing work that their agency does. MadPow is a first mover in the space of purpose-driven and human-centered design, something we need a lot more of in healthcare. So first and foremost, Amy, welcome to the Healthcare Wrap.
Thanks so much for having me, Jared. I'm really excited to be here.
Yeah, this is one of those conversations that we're going to hear the excitement in your voice of just the type of work you get to do. And I have a feeling you've had a chance to encounter some of the brighter spots, the innovation that's happening in our industry. And we can always use, good reminders of that type of innovation because there's so much going on in the industry. But, to help us get to know you a little bit better, you want to give us a little bit more about, what did I miss in your bio? Tell us more about MadPow and the type of work you do.
Yeah, absolutely. So I've had the honor and privilege of working with a team. We're about 70 folks over at MadPow, and we're authentically committed to improving experiences, improving health outcomes. We work in health, but we also work in other industries where we're focused on the intersection of what an organization is trying to achieve and what the people served by that organization are wanting and needing in their lives, so that we will create virtuous circles, uplifting cycles, if you will. And we call that purpose-driven design. So it's really human-centered design pointed in the direction of purpose. And we've been able to do that, this authentic, passionate, creative team, over the past 15 to 20 years for organizations across the health ecosystem. So that's payer, provider, government, nonprofit, health tech, pharma, really no stone unturned there. And that's led to thousands of interviews and co-creative sessions with patients and families, consumers, clinicians, essentially people in the health ecosystem, designing with them what would be a better health future. And really that's on two sides of the same coin in health. One is helping people to navigate the health system because people are left in the center of a disconnected ecosystem. Our system's sort of a mess, for better or for worse. It works well in some aspects, like you said, and then leaves some to be desired on the other hand. So we're working to reduce friction and provide more seamless experiences so that from, finding an appointment to figuring out how much things might cost to managing your treatment, that it's seamless. But then on the other side, it's health outcomes. How do we help people get healthier? How do we help them to change their behaviors? How do we help them move toward self-efficacy and just being healthy, vibrant people living life, right? So from, we don't want experiences that are where, people are having a great experience and it's delightful, but yet they're not getting better. And we don't want an experience where people are getting better, but they're having this miserable, frustrating experience, right? We want both. We want great experiences where people are able to achieve better health. And that's really been my passion and where we've focused.
Fantastic. That we're going to get into the broader context of what's happening with choices for people's healthcare in just a moment. But I noticed you're being really intentional about some of the wording you were using just there. And I'd like to dig into that real quick. One of those was purpose-driven and authentic as opposed to human-centered design. And you explained that. Then there's this part about health versus healthcare. Can you tell me about that? Because I noticed that, that was something that we're being clear about, health design versus healthcare and what we're trying to get at. Like, what are we trying to help consumers and people do with their health? So tell me about the need and being so intentional with using the word health versus healthcare.
Yeah, sure. So, healthcare is our system. I would use healthcare to describe our system. And we are a system dedicated to caring for people and their health. But to me, health is a more all-encompassing term because health is, can be emotional, it can be relational, physical, the whole mind, body, spirit, well-being. It also gets to prevention. It gets to lifestyle health, right? So, Planet Fitness wouldn't consider itself that they're a gym in this area. I'm not sure if they're nationwide, but they wouldn't consider themselves a healthcare company, but they're absolutely a health company, right? You could say the same for Nike. You could say the same for Peloton. Our focus should be improving health to the point where conditions are prevented, they're reversed, and they're treated well. And we're helping people to live their most vibrant lives. And I think that's really like the purpose. And the reason why I differentiate between human-centered design and purpose-driven design is that human-centered design, a key part of it is empathy. And empathy, there's two different types of empathy. One is cognitive empathy, and that's the understanding of the situation of another, their context, their needs, their goals, their objectives, their frustrations, their dreams. Emotional empathy is having the motivation to want to go about the hard work of helping to change the circumstances of another. And all of this factors into human-centered design, where designing with full knowledge and research being done with the target audience so that we're more aware of their need and we can design something that's better suited for them, and then having the motivation to see it through. It's usually focused on reducing frustration, increasing satisfaction. It's sort of designing the thing right? We want to move to designing the right thing. And designing the right thing often involves, yes, again, a full knowledge of people and their context, but you sort of broaden the lens outside of where we may have traditionally focused to fully understand the impact and embrace the opportunity for relationships and for a larger impact and a more meaningful experience within the context of people's lives. So that's why I've sort of made that shift in the language there.
It's great. And you really brought up a good point here about the difference in the system of healthcare that we deal with, the system that has been designed. And my hypothesis, my worldview is that we have a long way to go before this system, the traditional care system, fee-for-service system, all the words we use within the industry. We have a long way to go before we can really say that it is consumer first, because quite frankly, it wasn't designed that way. It was designed with other parts of business in mind. It wasn't designed to create the best experience for a consumer. There wasn't even, I don't think there was a large need for people to even acknowledge, like why would that even matter? And we live in a very different world now where that absolutely can make the difference between a provider that we're going to see, but not even just choosing between a couple of providers, but also choosing between other alternative ways of improving our health and not doing anything at all. That is absolutely one of those choices. And so for the healthcare system itself, that usually means a lot of the different providers and the organizations and all the administration around them, right? So all those different players are part of the system here. We've got to get to a point where we can say it's more consumer first. Like it was designed more with consumers at the center of the process instead of trying to retrofit something. And I think that's where a lot of innovators right now are. They're kind of in between these two worlds. They're trying to between incrementally improve what we've already got or reimagine and come up with a totally alternative system. And all that comes into play with what you were just sharing about why we refer to certain organizations as a health organization versus healthcare. I think it's just a fascinating way to think about things. And so my question would be, how do we use experience design as a way to create healthcare services that are more consumer first? Like, how do we use that as a tool? Are there any examples that come to mind or of projects you've been able to work on or ways that you've just seen that experience design as an umbrella of a lot of different tools? How can we use these tools to create better services to begin with?
Yeah, absolutely. It's a great question. And you sort of got at a really good point, which is, the difference between incremental innovation and disruptive innovation. With a focus on incremental innovation, we can improve the experiences be easy to do business with, quote unquote, right? Smooth the edges, help people understand how to navigate, how to interact with us, understand what the heck we're talking about, honestly, right? So we're kind of explaining the existing system and making it easier to interact with over time. And that's essential. Of course, we have to do that, but we also can take a step back and say, okay, how might it be? How could it be? How should it be? And do that by designing with the people who are affected by the system. And that's inside and outside of an organization. If you look at patient experience, for example, you have patients and you have clinicians and they're having an interaction, and not just the one clinician, you might have a whole care team, and not just the patient, you may have their family too. So how do we design for productive conversations and better relationships and better give and take and flow of data, and provide for a positive clinician experience? Because if they're showing up to the appointment and they are tired and they are stressed out and they don't have the tools that they need, that's going to affect the patient experience. And on the other side, if the patient shows up and they had to pay an arm and a leg for parking and they had a hard time finding the visit and they're stressed out because they don't know what's going on, that's going to affect or they're not prepared for the visit with questions and, or something's bothering them, they don't feel listened to, that's going to affect the interaction as well. So it's all interconnected, and we can sort of improve things incrementally, but also take a step back and reinvent them. And, you know, along those lines, just to explain sort of how it works, you know, usually what we'll do is start with research, and that's primary and secondary research. So we're actually talking with real people. We're doing ethnographic research, one-on-one interviews, observation, workshops to uncover the behaviors that matter, the mental models, the mindset, the needs, the jobs to be done. We have various methodologies that we can use to really start to distill and understand the problem space and the systems that are affecting the outcomes that we'd like to change. We do a lot in behavior to understand the psychology of the situation. We leverage behavior science and motivational psychology to really understand the humans involved. We're very complicated human beings, but also it's very important to go outside the organization or zoom into specific aspects of the organization and be committed to the question, be a student of the problem with an open mind, and try to discover exactly what's at play and exactly what's needed here. And with that insight and that information and inspiration, we can then go into ideation. And for ideation, we're coming up with different ideas that may solve the problem, but I'm a big believer in co-creation. So designing with the communities that we are affecting, that we are participating in, inviting them to the table of innovation. So we're designing with them as opposed to for them. And we're going to come up with better ideas that way. So those basically including the end consumer in the design process, we're buying down risk associated with spending a lot of time and money and getting it wrong. And then as we test these ideas and adopting a test and learn approach, we can start to narrow in on the best ideas and refine them to the point where they're going to meet our KPIs and our desired outcomes, evaluate that, measure that. We like to blend scientific method with creative process, essentially constructing these hypotheses and then testing them in the marketplace to be sure that we are effective. A great example of this that sort of ties together the digital experience design with service design, with health outcomes improvement and innovation from a business model perspective, and the behavior change design, changing the real world behaviors. One project we worked on that sort of knits that all together that had a great impact was for Dartmouth Hitchcock Medical Center. They spun out a new subsidiary called Imagine Care. It's since been sold and is now active in the European Union, but we helped them from the get-go through research strategy, design, implementation, iteration. So it was an entire ecosystem directed at patient support, self-efficacy, health literacy, and it involved all the bells and whistles, right? So AI and machine learning and the app connected to Bluetooth biometric sensing devices. So patients could understand where they are, how they're tracking, but also have a direct one-to-one connect with an actual human being who's looking at their data, is there if they want to reach out. They have a very proactive relationship where the humans involved on the clinician side are well-versed with motivational interviewing techniques and really helping people to make the lifestyle behavior changes and the therapeutic adherence that's going to help them to achieve better outcomes. In the studies we did following that project, we heard that from a subjective perspective, just the real stories, that people no longer felt alone. They felt like somebody had their back and they could get good information and feedback when they needed it. And then from just a data perspective, it cut cost of care by 15%, avoided visits to the ER, improved biomarkers, et cetera. So we knew the power of design to make these good things happen, but we were able to put it into practice in that context.
Very cool examples of just how hands-on that can be and how practically sound like you were working to address one particular problem. And that's what I really like about some of the methodologies you've mentioned and kind of the heart of the work that you do, which is falling in love with the problem, not with the solution. A lot of the kind of tenets, I feel like, of human-centered design. And again, as what I'd consider myself a design enthusiast, definitely not a practitioner, but I'm learning as I go. And I get excited when I learn about these new methodologies because of the time I've spent kind of spinning my wheels at times, trying to understand how I could increase adoption of a digital tool or platform or some content that wasn't quite getting the traction that we or our organization wanted it to. And so I spent a lot of time trying to understand how to nudge people in the right direction, I guess. And a lot of these methodologies just make so much sense to me. Another hypothesis of mine is that the disruptors in this space, the ones who are coming in, big tech, big retail, and then what Rock Health refers to as we've talked about it a couple of times on the podcast, the middle children, the middle players, the non-traditional consumer brands that aren't as big as Amazon, Walmart, Google, but they are the Targets and CVS's and Best Buys of the world that are entering healthcare and offering something new, some new kind of service or experience. There's all these new players coming in. I guess it's just kind of a hypothesis of mine that they very clearly have a different mindset and they have a different set of tools that they are playing with when they're designing a healthcare service or experience. How do we raise the profile and how do we bring those tools and methodologies of the disruptors to the mainstream?
It's such a good question. And we do have some sort of poster children or rock stars in this regard. I mean, PillPack was designed by folks who were, from IDEO and MIT. IDEO is a well-known design firm in this space, and they used human-centered design to come up with PillPack. And then you have, of course, Apple. They evolved from a technology perspective and put a focus on design. And it's not just the visual design. It's not just the aesthetic. I mean, any of us have used a piece of technology or been a part of an experience that was frustrating and not working as we intended. We do have approaches that we are working with. There's knowledge around process improvement. There's knowledge around sort of approaching things from the engineering perspective. There's knowledge around, the marketing toolkit. In human-centered design or experience design, if you will, is sort of a new entrant, and that is, 20, 25 years-ish old, although before that, it was human factors and ergonomics, and we were designing cockpits for airplanes and pilots. But in the sort of digital and service sphere, it's been the past 25 years. But I will tell you, it's being adopted and embraced more and more. And what happens is part of, one of the key tenets of design thinking and human-centered design is inclusivity and collaboration and embracing sort of an interdisciplinary approach. So we are constantly inviting people to the table from across the organization that we're working with to participate in this process. And once they hear from patients, once they participate in ideation, once they see how we need to sort of model and storyboard a service just like we would anything else, their eyes are opened and they sort of become believers. And they see the value, especially when we hit the nail on the head from an outcomes perspective. And then they want to do it again. And then the momentum grows, the love grows, et cetera. Now, there will always be sort of naysayers, why are we doing this? We don't have enough time. We don't have enough money, this and that. But once you've illustrated the success and the potential, people tend to come along with us. And so, when you get a passionate interdisciplinary team that is designing with the people they're affecting and using some very simple methods to visualize and then manifest these experiences, again, whether it's a digital product or a service, amazing things are going to happen. So we've seen a lot of companies, especially insurance, has very much embraced human-centered design, experience design, and innovation. We do a lot of work with insurers, and we have done some work with health systems. They don't have sort of a well-organized team yet that is budgeted and has a seat at the table, but it's getting there. Mayo has a service design team. Kaiser Permanente has a service design team. We've worked with many, many health systems. And so it's happening a little slower, I would say. And now we're having to the table life sciences companies that are looking at embracing digital as a new way to engage with patients in a more holistic fashion beyond the drug, whether it's patient support or a digital therapeutic that actually can be prescribed because it's improving health outcomes. And then to your point, we're seeing new entrants into the space that are showing us different ways of doing things, or sort of tipping models on their head, whether it's Parsley Health focusing on functional medicine and lifestyle and spending a lot of time with folks, or these sort of entrepreneurship programs that are going on at the larger companies. But you're seeing a lot of creativity, and it's well needed because we're not too healthy as a country. A lot needs to be done to put the focus on well-being, not in a paternalistic kind of shaming, scolding way, but in a let's live life to the fullest kind of way. And let's partner with people, not to just help them when things go awry, but to help them avoid that to begin with.
That's the question, isn't it? How do we do that? How do we get to a better point along that spectrum where we're addressing those upstream questions versus, like you said, what do we do once something's wrong and we need intervention within our own health and wellness journeys? Love that thought. One last kind of hypothesis to run by you here. And that has to do with one thing you just mentioned, which was for health systems in particular. So larger provider organizations and hospital systems and health systems, some of the inside big brands, if you will, in healthcare. I feel like we still see a lot of echo chambers, if you will, silos at the very least, of within their organizations still looking for solutions to some of their design questions within just other health systems. And they're not looking outside enough yet to other examples in other industries. Even within the broad health ecosystem, other types of players and organizations who they can learn from. And I feel like that's a limitation. I don't know if you've seen the same thing, or if you have, if there's a way to help improve that and help those within any type of organization have more visibility of the cool things that are happening in other industries.
Yeah, absolutely. We need to look at trends and signals coming from other industries because they shape consumer expectation. So people are going to expect out of an interaction with a health system, what they experience on DoorDash or Amazon, or name the latest app that they just used that had a great design team behind it, right? So people are bringing these expectations to the table. So it's important to understand what's going on. I think we feel like we're stuck in a system sometimes. We have the policies and the processes that are they feel like they're carved in stone and they feel like blockers to innovation. I think it was, 5 years back, it's like, oh, we can't do that because of HIPAA. And it's like, well, we can do that, but we can do it conscious of HIPAA, right? So we can innovate with HIPAA and not use HIPAA as an excuse not to kind of go the extra mile with the patient. But I think we can work with patients, again, adopt this spirit of co-creation, work with people to understand their real needs and wants and everything else. And I think to get beyond looking at it like we are just a brick and mortar facility, we are a hospital that people come to, we're a health system that people go to, primary care specialty, to say we're a services company, we're a relationship company, we're a lifestyle health company, we're a technology company, we're a digital company. And, I give health systems all the credit in the world. It's been extremely difficult, obviously, with COVID, even with EMR adoption and integration and just the busyness, the long hours, not even be able to take a break or go to the restroom, the clinician burdenment and burnout and all of the quality needs and the documentation. And I mean, it's very difficult to make change in that environment. It's not a tough nut to crack, so to speak. But I think if we create these little pockets where we start to innovate and think differently, then we'll be heading in the right direction.
One last question for you. If there's one message you'd like to share about creating consumer-first health experiences, what would that be?
Yeah, it would be, let's go beyond quantitative research and surveys and HCAPs. Those absolutely have a place in getting feedback from the end user, the target audience, the people we're working with. But let's also do consistent and continuous qualitative research, not just with sort of patient panels or advisory boards, because they end up knowing too much over time, but continuously bring people to the table with us, learn from them and design with them, and learn a little more about design thinking and human-centered design and create better experiences for yourself and for others. It's good work we're doing out there.
Well, thanks for giving us so much time today. How do listeners connect with you if they'd like to, and want to make sure we mention your podcast as well?
Oh, awesome. Yeah. I'm Amy Heymans on LinkedIn. You can connect up with me there. And I do have a podcast called Better Experiences, where we talk with leaders in health, thought leaders in health, about how we can deliver better experiences.
Fantastic. Again, Amy, thanks for giving us a few minutes and sharing so much value with us. All the best in everything you're doing. Stay safe, stay well, and we'll talk to you next time.
You too, Jared. Thank you.
Hey, thanks again for listening. We hope you found some value in this conversation. And if you did, do us a favor and follow us using your favorite podcast app. Then tell your friends and colleagues about us. If you like what you heard, please spread the word. Healthcare App is a member of the Shift.Health Content Network. If you enjoyed this podcast, you're going to love the other shows in the Shift.Health Content Network. Go check out the latest show. In fact, it's called Hello Healthcare, hosted by Chris Hemphill. It's focused on people who are moving healthcare forward, how healthcare strategy relates to data and AI, and what you can do to create or demand a better future. Subscribe on your favorite podcasting platform or at Shift.Health, where all 35 podcasts and video series are free and available on demand. Until next time, keep marketing forward. Thanks. And that's a wrap.